So welcome everybody to the All Hands on Deck webinar series. We appreciate you being here today. We have four really great presenters that will be sharing information in regards to their area. Today's is going to be focusing on child advocacy centers and their role in DEC efforts. Myself, Stacy Reed, I'm the Director of DEC Network Development for National DEC, and I will be co-hosting with Eric Nation, who's the Director of Training and Development. And our Executive Director, Scott Henderson, is also on here. I'm going to go ahead and have our presenters let you guys know who they are. So Jennifer Peck and Jessica Trimboli from Florida, do you guys want to introduce yourselves and tell us a little bit about who you are?
Sure. Hi, everyone. I'm Jennifer Peck, and I'm the Chief of Operations for the Emerald Coast Children's Advocacy Center here in Niceville, Florida. We're in the panhandle of Florida, if you guys are wondering where Okaloosa County is. Jessica, you want to...
I'm Jessica Trimboli. I'm a sergeant at the Okaloosa County Sheriff's Office. I'm currently assigned to our detention unit, but previously I was with our Child Crimes Investigations Unit, our Drug Task Force, which is where I met Eric and Stacy and the National DEC folks. And I've been doing this at the Okaloosa County Sheriff's Office for 10 years now.
Perfect. And we also have Sarah Van Doren and Emily Hitchcock from New York. I'll let you guys introduce yourselves.
I'm Sarah Van Doren. I am the Associate Director with Cayuga Counseling Services. We're a nonprofit. We oversee the Child Advocacy Center. We have an outpatient clinic, and we've done a lot of the children affected by substance abuse work in our community. And we are upstate. It's 1 degree. Right now, we were just talking about that before with our Florida friends. And so, yeah, we're about 5 hours north or something of New York City.
And hi, everyone. My name is Emily Hitchcock. I am the Director of Clinical Services here at Cayuga Counseling Services. And so, like Sarah mentioned, we're here to talk to you all today about our Children Affected by Substance Abuse program. And I am a licensed mental health counselor as well. So thank you, everybody.
Perfect. Well, thank you for being here today. I think you guys are going to have some really great information. We are going to ask everybody to make sure to put your questions in the chat, and Eric and I will be monitoring those. We will probably wait until the end in order to answer those, unless it's something that is imperative or on topic that we can stop things. We'll do that as well. If we don't get to your question, we will definitely make sure to try to email folks, but you can also email us questions at info@nationaldec.org as well. So before we get started and hear about the programs, I think it's really important to have the four presenters talk about what the child advocacy centers mean and what the role is in their community. So I'll ask the Florida folks to go first and just really talk briefly about what that child advocacy center's role is.
Sure. So I'm going to go ahead and cover that piece. So we are one of the oldest advocacy centers in Florida. We've been here for 22 years. We're modeled after the original Children's Advocacy Center out of Huntsville. And so we've stayed really close to that model. So we house multiple agencies within our center. We have 25 staff members that work for the Children's Advocacy Center, and we have different programs. So we have in our building with the other agencies, we have law enforcement, we have the child protection team, we have Department of Children and Family, those are our child protective investigators, and then we have staff here. So we're very, very lucky. We also have a prevention team, and I'll talk a little bit about that and how important it is, and it has grown our DEC program even more. So we have our therapist in-house. We're very lucky we have our trauma-focused therapist in-house. We also have our child protection team that does our forensic and medicals in-house. We work with 15 different law enforcement agencies between both our centers because we also have another center in the county over. And so our child protection team does our forensic medicals. We have medical staff. And then obviously our investigators. We see between 600 and 700 children a year that come through the center for some type of service with us. And so I'm a social worker by trade. I was an investigator for many years, and I always felt like drug endangered children were the ones that were falling through the cracks, because they're the ones that would make it to school. Even though they were up all night because of the chaos in their houses, and it was never identified. And so when I was asked years ago if I was interested in DEC, I had never heard of DEC. I absolutely said yes, and I got to go down to a week training in Gainesville with Jessica, and it was with Stacy and Eric, and that's where we first made contact. And it really lit a fire under a lot of us that were at that training. And so we came back and we decided to start DEC up again. And I reached out to all the agencies that we have relationships with, and it just grew and grew. We got hospitals involved and EMS, and it's a wonderful, wonderful coalition that we have here. And I feel like we have a very strong presence in our community and with all the other agencies that work with children and families in Okaloosa County. I'm going to turn it over to Jessica.
So Jessica, before we dive into a little bit more with Florida, I'm going to have Sarah and talk about just the Child Advocacy Center, how it functions up north, and then we'll come right back to you. So I'm not trying to cut you off. Hold that thought.
Okay, so our Child Advocacy Center, we operate in New York State under a special social service law. So in our state, CPS and law enforcement are required to do joint investigations through MDTs. And our MDT operates basically out of our Child Advocacy Center. So we have a separate location that's very child friendly, and we do all of the interviews if there's an allegation. Well, it's always been if there was an allegation of sexual abuse or what they consider to be severe physical abuse. So there was like this whole definition of that. And so a couple of years ago, we were really looking at the kids we were seeing. We listened to our community and really identified that the drug endangered children were kind of left out of that. So that's kind of where that work went. So what we do at the CAC is we do the interviews, we connect the families with an advocate that sits with them through the whole interview process. And then we also provide on-site therapy, on-site advocacy, case management. We have a full-time attorney that's on site. Our forensic interviewers are both retired law enforcement detectives, and so they came with a lot of that experience. They also coordinate. We have monthly MDT case review meetings where we review every single case that comes in at least once, and then if there's any follow-ups, we have our medical provider that attends those meetings. We were doing medical exams on site, but we're now contracting with another entity to do those, but again, it's not in a hospital, it's in another CAC that's in a close county. And so every month our district attorney, all law enforcement and CPS investigators, myself, the therapist, case managers are all on a meeting every single month to talk about every case that comes through. And so that's been helpful, and that's kind of the basis of where this program came out of. It was just built on that sort of model.
Perfect. So let's flip back to Florida, and if Jessica and Jennifer can talk about your programming and how it fits into DEC efforts and how you've utilized and started your efforts there, that would be awesome.
Absolutely. So our CAC is, from the law enforcement perspective, it's the same as what Sarah was talking about. We do all of the same things where it's the child friendly center and stuff like that. So this is our safe space. So when DEC contacted our CAC back in 2017 or something like that, Jennifer and I kind of got told to go to this training, and we had no idea what we were getting ourselves into, but we got a fire just put under us from the amazing training we were provided by National DEC with Eric and Stacy. So when we came back, we all sat at this table, and we talked about it in class a lot about bringing everybody to the table, but here at the CAC, we really have this big table where we brought everybody, and it made everybody talk about what we have to offer. So I'm just the cop, and that's what I call myself all the time, but I have all of these passions with kids and making sure that all the kids are taken care of, and that the kids that are exposed to drugs from families or friends or whatnot, I want them to have help and to have all the hugs and all the love and not be forgotten about. And I didn't know what I could do as the law enforcement officer for those children if no crimes were being committed in my presence. Well, coming to the table with all of these disciplines, we have the CAC here who Jennifer knows all of the different social working agencies they work out of here beyond the arrest. I didn't do anything beyond the arrest back then. So when Eric and Stacy trained us, we went to another training that taught us the networking with the roadmap and toolkit and getting who we need at the table. So we thought about it and we were like, hey, what about the garbage company? Those people go to the houses and see the trash is full of whatever, and making sure we don't miss somebody that may have the exposure to those drug endangered kids, so we don't miss them. So our CAC comes into play there. CAC is where we host our meetings. The CAC is our safe place. It's a locked, secure facility. So all of these disciplines can come in here. We can all talk about, the ideas we have or what we see, because Jennifer and her side, they see specifically those trauma children. We may see kids that aren't necessarily at the threshold of, needing the CAC services, but they may be able to get service through DCF or through DCF is our Department of Children and Families, by the way. So services through other agencies and other entities that I didn't know before we brought everybody to the table here at the CAC. So that's kind of how we operate here in Florida, is we have our monthly meetings. We keep in touch. We do an agenda. We talk about what projects and goals and ideas we may have. We've done some things let's see if I can show you with this camera here, but we made this QR code. So what this is it's actually a sticker. And if you know anything about law enforcement, we like quick, easy, accessible resources. This is a sticker, and all law enforcement, they carry the clipboards that open up with all their paperwork inside. Stick this QR code on your clipboard and you get out with somebody that, doesn't need to go to jail or doesn't need to go to the hospital, and you can give them access to quick resources. And this is our CDAC Behavioral Center, and I'm not sure what the acronym is, Jennifer could tell you, but they're part of our DEC group. And with a quick picture of this QR code, anybody on the side of the road can have access to all of our resources in Okaloosa County, which I love the Check DEC app. So I'm so excited to start sharing that with our QR codes as well. But stuff like that we can do with our DEC meetings here at the CAC. And nobody knew that those things were going on because we didn't talk before the silos were broken down after we all went to our DEC trainings.
One of the things I want to add on to, which was really shocking to me, is so we have a prevention team. We have 4 amazing ladies that are in schools doing child and teen safety matters. This is telling kids how to stay safe, find a safe adult, cyberbullying, internet safety, all that kind of stuff. And the amount of kids that were disclosing to our prevention team where drugs were involved we couldn't believe it. We see between 30 and 40,000 students a year, and we could not believe the disclosures that we were getting about drug endangerment in their homes. And so that was a real eye-opener for us, and how it is so present in so many kids' lives. That really gave us an overall view. The other thing is our prevention team does mandated reporting, because in the state of Florida, by law, if you're over 18 and know or suspect child abuse, you have to report it to our hotline. When we went out and we got people to the table, we were stunned that EMS, firefighters, drug task force, everyone didn't even know how to identify drug endangered children. And that was shocking to all of us, including them. So we got them on board as well, because they knew that things weren't right, but they didn't know what to do with it. So we assume that these professionals know what drug endangered children are and what it looks like, but they really don't. And so education in the community is huge to make your program grow.
Just a couple of I wrote down a couple of quick notes because I knew I was going to forget. So our QR code was one of my most favorite pieces, because again, law enforcement, we love quick access to resources. Because if you tell me we have all these resources, I'm not going to remember when I work a midnight shift. So quick access resources are very important to us in law enforcement. But so because we have our hospitals on our DEC group here in Okaloosa County, they started a cord blood testing program with our hospitals. So any child that's born in our hospitals automatically gets cord blood tested. Back in the day, if a child was experiencing symptoms of withdrawal or whatnot, or if they knew that the parent was using drugs, then they would send it off, and it wasn't necessarily an all the time thing. Now it's an all the time thing. So we learned that through our DEC program here in Okaloosa County, as well as Handle with Care. So Handle with Care was a fun one for us because I hit a lot of brick walls in law enforcement with trying to get that passed along. I wrote the policy because in law enforcement, again, policies and procedures are the Bible for us. So I wrote the policy back in 2017, probably right out of DEC training, and got to the top and it got denied. And it wasn't for anything negative behind it or whatnot. It was just, nobody was really sure about what this meant. We already call each other, so why do we need a policy or procedure? Well, this year, January of this year, it's through. We got it approved. Everybody had to sign off on it. Handle with Care is up and running in Okaloosa County. And when I was in the schools as the supervisor over the school resource officer, I had so many teachers come to me and just ask me if I knew what it was, because they felt so, what's the word I'm looking for? They were so excited that they had that little piece of information. They didn't want to know what happened. They just wanted to know that, hey, this kiddo needs a little bit of extra care today. So they were just so excited to get that little piece of paper that said Handle with Care. And we used the example from West Virginia to model our form after, and they gratefully gave it to us and told us how to get it up and running, and told us about any challenges that they had over there. So that was really exciting. And then, of course, we do DEC trainings often in our community. Jennifer and I love to piggyback with each other because I love the cop jargon. I love the stories, and everybody loves cop stories. And then Jennifer comes with kind of the really good experience with long-term wraparound services with kids and how to make it all work. So here in Okaloosa County, we're super excited. Our DEC program, we hit walls with COVID, as everybody probably has, with having to do everything kind of via Zoom and whatnot, but having the access to the programs that you guys recorded through Fox Valley has helped drastically. We can kind of send that out and share that. And then if somebody's interested in a face-to-face training, we can go out and do it from there. So we're still getting bites on getting training out there, but yeah, it's great here.
Perfect. Can you guys just talk briefly about your dogs?
Oh, yes. So we are very lucky. We have pet assisted therapy dogs in both of our centers. They're a really vital part of our program. For many reasons, they can sit in forensics. We got permission for that. They go to court with our kids. They sit in our depots if needed for kids with our state attorneys that are located here at our centers. So all in all, they're very comforting for kids. And right now we have 4 main doggies. We have a Great Pyrenees named Elsa, and she's absolutely wonderful. And then we have 3 Cocker Spaniels that go between both centers that are with the kids. So really makes a difference all the way around. They also really comfort staff. The work we all do is very intense, can be very emotional, and just to have a big hug from Elsa is just amazing. So we're very, very lucky. Is that what you need?
Yeah, no, I love that, because we're hearing a lot of different ideas. So I think that would be, we're hearing a lot across the nation about how people are utilizing therapy dogs, and whether it's through CACs or police departments or child welfare, the courts. I just love that idea. It's brilliant.
Yeah. They really make, we have 2 Malteses, Cody and Riley, that have been with us since 2015. And they really were our star therapy dogs. Riley's retired now, but we just get more, and it's just amazing. They're just wonderful. So all the way around.
So one question where do you get the dogs? I know that there's probably numerous places, but there was a question in the chat, so I figured I'd ask.
So we were very lucky with Cody and Riley because our clinical supervisor was actually their handler. So she was completely licensed and certified in pet assisted therapy. So she could actually take Cody and Riley into the sessions with her when she was doing her therapy with our kids. So our other dogs that come in now, they're all with their handlers that somehow are involved with the center. Elsa's handler is one of our volunteers here at the CAC. And then Barb, who has the 3 Cocker Spaniels, is also one of our volunteers, and she also works for us part-time. So I know other centers will contract with dogs and bring them in, and then they take care of the dogs, and the dog, and then the dogs go to the handler. I've also worked with centers before where they buy a dog and the center owns the dog, and then staff is responsible for the care and upkeep and everything. So there's lots of options with that.
Perfect. Well, thank you guys for sharing. We're going to switch over to the New York folks, and then we'll come back to everybody at the end for questions. So Sarah and Emily, I will let you take it away.
Thank you. So yeah, I wanted to introduce you all to what we call our Casa program. So that stands for Children Affected by Substance Abuse. I understand Casa to most of you means something different with court-appointed specialists and advocates. Of course, we have a different name for that in New York State. So CASA for us stands for our children affected by substance abuse. And as Sarah mentioned before, at our CAC, we have this great team of people who had, recognized that the drug endangered children were falling through the cracks. There was a need for this program in our community, and we already have a working team behind us. And so for us, it was a no-brainer to develop our CASA program housed within our Child Advocacy Center. It's already a child-friendly, trauma-informed environment. The kids are greeted by this beautiful mural when they come in. We have Netflix on the TV, we have snacks, we have teddy bears at all times for kids to go home with. And those little things matter to kids. I used to work with a kid for a long time who referred to our CAC as my house, which I loved because it wasn't clinical, right? It wasn't like a hospital setting or even like our outpatient clinic setting. It was my home and it felt safe for him. So that always stayed with me. And we also have our therapists are already trained in trauma-informed practices. And so, like I said, this was a perfect setting to develop CASA. I agree with what Jessica and Jennifer shared earlier about the importance of outreach and education. As I said, we had our MDT support, but I made a point of the summer that we started CASA, I went on tour all over Cayuga County and made sure everybody knew that CASA exists and what we're doing. I even went to laundromats, libraries, all of the doctors' offices here to make sure they know we exist and we're here to provide presentations or psychoeducation, anything related to DEC children. And so the other thing we were really mindful of is how we structure this program. From start to finish, we were really mindful about from the moment we are introduced to these families, that we want to make sure we have trauma-informed practices in mind. And so our intake is very structured, where we meet with the caregiver first. That way they can share concerns or particular traumas that maybe the kids have been through, and that the kids weren't present for it. They've already lived through that. We don't want to re-traumatize them. It was important for us to gather data in the beginning. We track ACE scores, Adverse Childhood Experiences, for those who don't know, is a 10-question yes or no screening tool to get a sense of essentially of what adverse experiences has a child experienced. And so for those who are familiar with ACE, we know that a score of 4 or more indicates mental health problems down the road, physical health problems down the road, an increase in likelihood to develop alcohol and substance use problems themselves. And to give you an idea of what we learned in our CASA program is that these kids have complex needs and complex trauma. 82% of our CASA kids had a score of 4 or more. So it's significant. So some other things that I'm really proud of about Casa is through our relationships with DEC, we were introduced to Jerry Moe at a conference and therefore introduced to his curriculum. I could talk about Jerry Moe for like a half hour, so I'll try to keep that brief.
Stacy, you're gonna have to cut her off.
Yeah.
She's obsessed with Jerry Moe.
That's a great thing. That's
I would
awesome.
recommend anyone to look at his resources and books out there because he's a wonderful children's therapist. And so we modeled, we developed our Casa group. And so again, that was taken from his curriculum, which is supportive education for children with addicted parents. It's a free resource online. And we developed our 12-week group for Casa kids ages 7 to 12. And I just wanted to share a couple data points. So when we run the group, we always do these post and pre and post tests just to get an idea of is the children's knowledge and values and beliefs about addiction changing. And so 50% of kids at the beginning of the group, one of our groups shared that they felt like they were at fault for their parents' addiction issues, which again is significant to me. At the end, 0% felt that they were at fault of that. So the group is powerful. It tells the kids that they're not alone and that there's other kids who are dealing with very similar experiences. And in fact, the kids loved the group so much that we ended up developing a recreational group after that, where the kids could join and do activities and fun stuff with kids, like-minded kids who've had shared experiences. We also have resources that we've gotten through DEC, such as Timby Talks, which is a great book. We have the plush toy activity set and coloring book that we hand out to every kid who comes through Casa. We've been able to share that with our partners as well. Law enforcement has Timby Talk plush toy sets that they give out, probation, some of the local schools. And so in the 7 C's, again, that's another thing that Jerry Moe developed. And we created these little palm cards that focuses on the 7 C's, which is really foundational to me in what we do in Casa and what we should do with DEC kids across the board, which is teaching them, they can't cure it, they can't control it, but identifying the things that they can take care of, which is celebrating themselves, communicating their feelings, and taking care of themselves. And so that little palm card we hand out to every kid that comes through our program. And we have kids that come back and say, can I grab one for my friend? Or can I grab one from my sibling? So it's those little thoughtful details that I'm really proud of what we've implemented or have a part of our Casa program, in addition to traditional therapy. So our therapists are trained in trauma-informed cognitive behavior therapy, which is well-researched, evidence-based program that helps kids who've experienced trauma. We're trained in EMDR, eye movement desensitization, reprocessing therapy, as well as parent-child interaction therapy. We also have case management, advocacy. We really try to meet the needs of the family as a whole, which led us to one of the other things that we were finding in our program is there was a lot of grandparents raising their grandchildren. We had grandparents coming in and asking us, how do we talk to our kids about addiction? They don't know, we kept all this from, they have no idea what's going on. And so that led us to develop our psychoeducation curriculum, where we were working with the caregivers on how to talk to kids about addiction, that it is important to talk to kids about addiction. Therefore, they're not internalizing it and feeling like it has something to do with them. And we've gotten great feedback that that's been helpful as well. So we're constantly looking at the trends that we're seeing in our program, what our families are telling us about their needs, and really structuring our program to around that. And I'm really proud of what we've done. I'm gonna check in with Sarah to see if I've missed anything though. Did I leave anything out?
No, I don't think so. There's just a couple of things. So we we're kind of a small county, and so there aren't any other DEC alliances in our state. New York State, being as huge as it is, doesn't have any DEC alliances. So that is something that we're working on bringing to New York State in partnership with DEC. And so that's something that we're also working at the state level. So we've reached out to our Office of Children and Family Services that basically oversees and sets the guidelines for child advocacy centers. centers across the state and explain to them that this is a need that we're seeing, and we've advised them that we're trying to bring this work to New York State and they want to be a part of that. That's important to them too. And there's other CACs across the state that are reaching out to us and asking us like for assistance and how can we develop a program like Casa in, you know, our county. So I think that that's really important. We've done a lot of the groundwork in our county, but also we're really trying to expand it. I feel like at least once a month, Emily and I are on one of these calls with somebody, whether from Stacy, mostly from Stacy, or somebody just saying like, will you talk to these, you know, this agency, they're really interested in thinking about this, because I think that it's like before we were doing it, it was like, now that we're doing it, why haven't we been doing it this whole time? Like, how did it go on in our community this long where we're focusing on physical abuse and sexual abuse, but these drug endangered children are like not getting all these specialized services at our CAC? And I want to share two things because I'm super proud of them and I would love if we can encourage it. So we started probably a year ago. We bought this huge canvas and we hang it on our wall. So just a big blank canvas. I mean, it's like 6 feet by something. And every single kid that comes in gets to do a handprint. And it serves two purposes. One is we have a visual that we can show people or we can look at every day. And then we were reminded on why we're doing this work. And it hangs right in our hallway. But the second thing is the kids get to come and they get to see all the other hands. And then they understand there's all these other kids that have been here and have done this stuff. And so if you don't mind, Stacy, I really like to share it because it's something that my entire staff is basically like, oh, I can't because you're sharing. So never mind. That's okay. But I just thought that it would be something like visual, and we're going to use it on our promotional stuff. And it's just a really important piece. And mostly the kids all the time, well, they love it, first of all, but I really do think it gives them a message like, hey, I mean, right now there's hundreds probably of finger or handprints on there, and they've made comments, and it's like, it's not just me, and there's all these other people that are going through the same thing. So that's something. So yeah, I mean,
that's super powerful, just
it is
in and of itself. So I'm hoping that everybody on here will take that back and start that, because I think that would be, wow, that's powerful. That's cool.
And they love it. And it's always our belief. So of course, when the kids come, they can't have a snack before, because for whatever reason, law enforcement doesn't like that. So before their interview, they have to wait for their snack. They can't get them all sugared up right before. But like when they're done, they get to have their snack. So they go through something really awful through the interview. Sometimes, I mean, we try to make it, but I mean, obviously that can be really difficult for a kid to go through the interview process. So when they're leaving, we really try to leave it on a good note. So they get their stuffed animal, they're doing their craft. We do crafts based on, different times of the year, whatever. They always have something they're working on with their advocate. And then they get to do their handprint when they leave. And generally kids leave in an upbeat, they feel good, or at least are in a good place when they're leaving, because they have their stuffed animal. They left on a higher note, right? And then they just love the handprint. I can't even tell you. So, yeah. I saw the comment. I wanted to do it on our wall too, but my boss said that canvas. But I'm actually happy about that, because now we get to start with a new canvas, and I'm going to hang this one here. So. But I have heard of that. Other places doing it on the wall. But anyway, I mean, that's just some stuff. We're constantly doing surveys. We're constantly evaluating our program, getting feedback from our MDT. So if we find something, like if a survey from a client says that, or actually that's why we started our recreation group, is because kids in the parents of the children in our group said, our kids really love this group and I'm so sad it's going away. And and so we're like, okay, how can we make that not happen? So we started the recreation group during COVID. So what we did is we bought a bunch of art supplies and canvases and all this stuff, and we sent the packs home to the families, and then they got on Zoom and they were able to do their activities just on Zoom with their peers that they've been with for 10 or 12 weeks. So those are just some of the things that we're constantly trying to make sure that we're making the kids feel good. I mean, that's our whole goal, and providing them really good treatment, evidence-based treatment. We're always getting our staff trained, and yeah, I could go on for long, but I know you said 20 minutes, so I'm just gonna stop there. You already know, that's why you're laughing.
No, I love the information. And so I hope everybody is seeing that there's lots of different ways to do the work and lots of different tools to implement. And so I did put some of the tools that were talked about between the Florida folks and the New York folks in the chat. And if you want more information on them, just email us at info@nationaldec.org and we can connect you to all the right people. Jennifer and Jessica, do you have anything else to add, or do you have questions for Sarah and Emily that you have thought of?
I don't think so. I'm not sure.
No.
What about
know
Sarah
it's-
and Emily? Anything else from you guys? And
No, I
So
don't think
Stacy,
so.
while you're looking at the questions that are maybe in the chat, I do have a few questions that have been sent to us over the past few months and over our past trainings and stuff that I think would be a great opportunity to ask this group.
perfect.
So the first one is historically we see child advocacy centers, like I think both of you have brought up, really focusing on that physical and sexual abuse type stuff, interactions with the children. And I would like to hear from both groups, Florida and New York respectively, on how bringing DEC into the child advocacy centers with the partnerships of kind of that DEC mindset where there's really no boundaries in who's our partner, how it's benefited your community. And I'll start with Florida if you guys don't mind, and then we'll go to New York.
Sure. So one of the interesting things where we were noticing with our drug endangered children that were coming through the centers is that when they were scoring very high on trauma symptoms, and so with working with physical and sexual abuse kids, we always have to assess where they're at, what kind of symptoms they're having. And we were really shocked to find out that drug endangered children are having a lot of the same symptoms that these egregious abuses were, that the same victims, they were having the same symptoms as the most egregious victims we were seeing through the center. And so I wish we could see every drug endangered child and get them through some great therapy to get them back to a healthy, happy life. But unfortunately, we just don't have the resources to do that. So love the fact that our schools are trauma informed and they have social workers and mental health counselors in our schools that are starting to work with some of these kids, DEC kids, because there's just no way that we could see all of them. So that was a really important thing that we learned with our DEC Alliance, is that these kids have the same trauma symptoms of kids that have been physically and sexually abused.
And for us
Thank
here
you.
too,
Yeah,
for us,
go.
we have, sorry, do you want me to go or do you want to go?
Go.
Okay, so for us here, what's cool about here in Okaloosa County and really the whole state of Florida is we're mandated by law to have a school resource officer in all schools. Granted, in Okaloosa County, we've had them forever, since I was a kid, which you may not think was very long ago, but it was a decent amount of time ago. But because our school resource officers are already in every school, they're connected. So our handle with care process, although it's policy now and it's driven by making sure the notification it happens. Back in the day, if you work a beat or you work a zone or you work that particular area and something happens with a kid that you know is in school, oftentimes that communication already happened. So when we met with the DEC folks and we learned about the handle with care practice, we thought, oh my gosh, this needs to be bigger than we already have it here. So the goal and what we're working with our school districts. So that's another thing with DEC, our school district, our school board is on our DEC committee or our DEC Alliance. So they help the school agree with the process. So we have a contact at the school district that actually sends out the handle with care to the respective school principal, and then it filters out from there with the process. So every year we train the SROs on DEC, be it just a short update or the full thing, depending on how many new school resource officers we have. We also train all the principals and the school district personnel on DEC every year. To keep everybody kind of up to speed, which then brings the mandated reporting questions, the child team safety matters, all the prevention team trainings and curriculum that they have here at the CAC. So it just reminds everybody that we have all of these things out there that can be in the schools and kind of touch and see and not miss kids. Because that's the whole point of DEC, is we don't want to miss the kids that are quiet and just showing up at school every day and seem all right, but something is actually going on at home.
Perfect. So I'm going to now turn the same question over to Emily and Sarah, but I wanted to clarify something real quick because I've done a lot of work we have with you, Jessica and Jennifer, and you brought up Handle with Care a couple times, which is an excellent tool on the tool belt. But I want to clarify that you guys really started with the foundation of that being the DEC Alliance, and then you needed that structure, that foundation, which was your DEC Alliance, and added the Handle with Care to the Alliance as like a toolkit.
That's right.
Absolutely.
We couldn't have done it without all the agencies that were involved, including the school district, EMS, because they also, respond to everything. How many cases we see of unresponsive parents due to overdoses, and it keeps growing. And so it was really important to engage ERs, EMS, and hospitals because they see it every day. And so that was a huge leap, like you said, Eric, just engaging, setting that foundation so that we could start doing prevention and getting the word out there and setting up resources. So when we do identify those kids, we know what to do with them. We're just not leaving them flapping in the wind.
Well said, Jennifer. Well said. So Emily and Sarah, same kind of question about the benefits of bringing DEC into the Child Advocacy Center, where it's that multiple disciplines that are the norm for the Child Advocacy Centers, and how it benefited your community.
Sure. Well, I'll say that I think the work that we've done, what we found in Casa is that the outcomes matter, and we're constantly sharing about our data. Like I said, we collect data on ACE screenings. We do child PTSD scores every 6 weeks with our Casa kids to measure progress and success rates. As Sarah mentioned earlier, we are constantly surveying our clients and families to see if we're missing anything or what the needs are, what's working, what's not working, and we're sharing that with the team consistently. And so what they're hearing is how this is working. It is helpful to have this focused program for these kids who have been overlooked previously. And the other feedback we get too, and not just from our MDT, but from the community as a whole, is that it's nice to know, okay, this is, if there's a kid, a drug endangered children that in the community, I know they have to go to Casa. Casa will take it from here because, like I said, we have all the variety of services that meet the family's needs. It's not just that one child, it's the caregivers needs when it comes to legal services or case management, or even if they need to just look in our clothing closet and get whatever supplies they need for that day, they know they can do that here. So I think it's just making sure we're constantly letting the community know we're here and it's working. And here's the evidence to show to back that up, so to speak.
Yeah, and I do feel like prior to implementing this program, the services were disjointed. So we didn't necessarily know about these kids at the CAC, and the CAC, in our opinion, obviously we operate it, is the place that these kids should go. I mean, it's designed for traumatized children. It's meant for kids. That's what it's for. And I can't think of these kids going anywhere else. And I mean, it's everything we do is for them at that site. So it's like, these kids should be treated the same way. And so I did think it was a retraining of our MDT. We're still working on it. So we bring our partners with Stacy and Eric. And I will say that one of our law enforcement agencies that went to one of the trainings recently did come back and has started implementing some changes in his department as far as learning from others. So learning from another law enforcement agency about how they deal with drug endangered children and what they do. And I think that that's like the work that we've been doing, but we know that law enforcement has to tell other law enforcement how these things work. So we're happy to sort of facilitate that. I think that's really important. We definitely understand that, but it's just been really great. We've gotten great feedback, and I think a lot of our partners are very vocal. So if there was something that wasn't working, they would certainly tell us. But I think, like I said, prior to this, there wasn't like a place, like if they saw a drug endangered kid, like right now, if they see a kid with problematic sexual behavior, it's like, oh, send them to Cayuga Counseling. So it's become the same thing now for the DEC kids, where before it was like, oh, I better refer them to therapy to this agency, but oh, mom needs this service from this agency. And it's like that we just eliminated all of that and we do it all. And even if we can't do something, we at least are overseeing the case. We're reporting to the MDT and we're collaborating. So I think that that's been a huge benefit to the kids and to our community, and that's what we've heard.
That is awesome. Emily, I am going to have you clarify again. I know you did it early on. Will you please just clarify CASA from your guys' standpoint when you talk about CASA in case we have
Yes, of course. So CASA, when I say CASA, I'm referring to our children affected by substance abuse program. Yeah.
Awesome. Thank you so much. So I love the mindset shift that these two child advocacy centers have had in their community. But with that change, as we know we are all resistant to, Jessica, I'm going to come after you now, okay? When we have that mindset shift, we have then got to educate our other disciplines back out there on the importance of that early identification. And you're talking fire and EMS, you're talking probation, parole, you're talking law enforcement. But this is a mindset shift because a lot of us aren't used to working with the child advocacy centers, and now it's something that's been introduced that is beneficial to the kids. Can you talk about how we can change that mindset out in the field to the first responder level?
I mean, I think it's just all about exposing it, talking about it. I think as soon as people talk about things and they hear that it's out there and it's easily accessible, again, quick resources, like we all like quick resources and nothing that's some complicated long email address or, different process of 6112. I don't even know the numbers, but quick resources. So when we talk about these things, and again, bringing law enforcement into this group kind of set us afire, because when you train other cops as a social worker, they aren't as receptive if it's not also being talked about by another cop. So when I was in the drug task forces, whenever I started in DEC or started with this alliance here, and because of my connection to the drug task force, I was the one there with them whenever all the doors were being kicked in and the search warrants were being written. And it was so related to what Eric teaches in the DEC training. Because of that, because we spoke about it, because we trained, as soon as I got back from the Train the Trainer program, I immediately trained my drug task force coworkers. And right away, the very next day we did a search warrant, and the very next day the mindset switched. So it was amazing to see that, because I didn't know what it was going to do. I mean, I was a new drug task force investigator, and a lot of them were senior guys that have been doing it for a long time. They're very eager about getting drugs and getting the bad guy, but the kids were on scene. And typically we make sure kids aren't on scene, but we can't always determine whether or not kids are going to be on scene, especially with people moving houses. So when the kids were there, immediately the mindset switched, and I saw some of the guys go and stay with the kids immediately, and they started asking them questions and just talking to the kids and playing with them and making sure that the kids knew that the cops aren't the big mean bad guy, and just that subtle mind shift. It was amazing. And then of course our connection to the CAC in our child crimes division. We used to have an investigator here housed at the CAC. We split now, but a lot of our investigators are still assigned back and forth between the CAC. So we've got such a good relationship already that the mindset switch with adding DEC to our puzzle, it made everything so much bigger and so much better. Everybody's eyes opened much wider than they used to be.
That's awesome. Thank you so much. Stacy, I think we have one question that has come in on the comments, and then I have a follow-up if you don't mind before we wrap this up.
So we do, and I love this question because I think it's on a lot of people's minds, and if not, it always comes up. So when whether it's New York or Florida or both, when y'all started including DEC cases in your CAC's volume of cases, did it dramatically change? Was it manageable? Did you need to train staff in different ways? Like, how did that, once you added drug endangered children to your efforts, how did that impact what you guys were doing at the CAC.
Right.
Florida, do you want to take that first?
Yeah. So I wish we had the funding to hire lots of therapists to work with our DEC kids, but unfortunately, we all know the reality of nonprofits is that's just not going to happen. So the kids that we see, our DEC kids that we see, unfortunately, are the most egregious ones here at the center. Again, we rely a lot on our mental health counselors and social workers at the schools. They have constant contact with these kids. They see the improvement, they see the digression. So we work with them quite a bit in identifying those children. We do see some DEC kids, but unfortunately our therapists are so busy with sexual abuse and physical abuse that our DEC kids have to be seen somewhere else most of the time. We just can't do it. And that was one of our biggest obstacles is we came up with all these great ideas and how to implement it. But what do we do with these kids? Because there's hundreds and hundreds and hundreds of kids that are drug endangered and we can't see them all at the CAC. So how do we do that? Groups, we've done coping skill groups with some of them, the most egregious ones. And again, we work really closely with other agencies, other resources that might be able to see these kids and follow up and make sure that they're safe.
That's excellent, Jennifer. Thank you. Emily and Sarah, what about you guys?
Well, yeah, we actually got from the Office of Advocacy program to build relationships. So our introduction was to DEC was when we accidentally went to the statewide Wisconsin DEC conference, thinking it was like a national. we're the only people here not from Wisconsin. But anyway, when we went there, but we used that money for that. But now that money is gone, we did sustainability planning probably 6 months in because we didn't think it was going to be like a refunded grant. And so we've requested and gotten approval from our Office of Victim Services in New York State to include these children. As long as they're a victim of crime, we can see them at the CAC. And when we're reapplying for that money this year, which is RFP's out now, we will be rolling in DEC kids into that. So that's, yeah, I mean, there's not a ton of money out there, but we were able to use, we're a victim serving agency, we get those funds. And also I asked for and included them in our policy and procedure for the Child Advocacy Center now. So we're able to see those children under our state funds for our Child Advocacy Center. So that's how we did it. But we did have like seed funding.
I just want to say those 3 years where we really did have a Casa program that was consistent of a program coordinator, 2 therapists, and a case manager where we can meet weekly, talk about these cases, what needs to be done, who's high risk, who needs additional resources. That foundation really helped us get Casa going, to focus on these cases, to get the good outcomes that we were getting because we were so invested in these families. And then, of course, we trained other therapists later on too.
So I have one more question, and I think probably it's directed more at Emily, since you're kind of that clinical side. So have you noticed any difference in success with client engagement for drug endangered children or substance exposed kids at the CAC versus sexual or physical abuse cases? That's a great question.
It's an interesting question, and I wish I had like specific data on that. I will say that our Casa kids hang around for a long time. Like these kids have been, even with me for sometimes over 3 years at this point. We know the families. They might not be receiving as intense therapy at this point, but we still have relationships with them. So I would gather that we do have, again, and that's because we had that like focus of just focusing on Casa kids for 3 years, that did result in closer relationships with these families and therefore more consistency in attendance and better outcomes in therapy as well.
And are you using the same therapy modalities that you would for the physical and sexual?
Yes, yeah, thank you. So we are using TF-CBT, EMDR, parent-child interaction therapy. I recognize that those are a lot of acronyms, but all of those evidence-based trauma therapies, interventions that you hear about, all of our staff are trained in that, and it was a priority for our Casa therapists to be trained in that as well.
That is awesome. So Stacy, we got 2 more minutes left. I'm sure you have more questions, and we could send those to Sarah and Emily and Jennifer and Jessica. We are very fortunate to have these 2 organizations and these 2 jurisdictions that are doing DEC efforts, and the amazing work that you guys have done, you guys should be very proud of. Emily, you did bring up a stat that I kind of want to end with here that I don't think shocks me, but it hit my heart. And that was 50% of these children are feeling responsible for their parents' addictions. I would really love to obviously see that become 0, because we know these children are not the reason for this. But that stat has stuck with me through this presentation. And I think that's something for all of us to think about as we move on here. And we've had another great webinar. But I also want to point out, outside of that stat, Jessica, I've watched you guys use this QR code in Florida, and we've shared that model throughout the United States. So I think that QR code has been a great resource, and I don't know, you guys are all amazing. Any final words from you guys before we have Stacy wrap this up?
I just want to say thanks for having us. I'm always amazed that you guys call me and continue to call me, but I love DEC. I love everything about it. I talk about it constantly. My supervisors hear the word DEC probably at least weekly. So I love DEC. I love what it does. I love just speaking about it. It's my passion. These kids are something that I live for. So I thank you for having us here at Okaloosa County. I love it.
Thank you. Sarah and Emily, any final words from you guys?
I would just echo this. This is like my passion to talk about CASA and what we do here. And so thank you for thinking of us and including this in today's presentation.
Yeah, thank you.
Well, thank
Stacy?
you guys. Yep. Yes, thank you to the speakers, and thank you to everybody that was on the Zoom today. We appreciate all of the work that you guys are doing in your communities. Please don't forget to connect with us either through our website, nationaldec.org, or through our new app, Check DEC. There's lots of great resources, and please keep in touch with us. We look forward to hearing from all of you. Thank you again. Take care, everyone.